Hi, I'm Julie. I'm here at the office with Dr. Foster, and we're here to talk about minimally invasive surgery. So, Dr. Foster, what is minimally invasive foot and ankle surgery, and what sets it apart from other foot surgeries?
Well, minimally invasive surgery is really exactly what it says. It's just doing a surgery through a very small or a minimally invasive incision. And what sets it apart from traditional surgery is that it allows us to do surgeries that typically took large open incisions and doing with very small and very simple incisions.
And how long have you been doing minimally invasive surgery for?
Well, I've been doing some minimally invasive surgery for probably about 15 years or so, but I've really changed my entire practice to almost 100% minimally invasive foot and ankle surgery for about the last 7 to 8 years.
So, what are some of the benefits that the patient can expect from having the surgeries?
Well, there are a lot of benefits to that, but some of them are one is with a smaller incision, you're going to have less risk for infection. And usually, with a smaller incision, also, you're going to have less pain. Most people have much less pain with a minimally invasive approach. And that also means that there's going to be less complications, typically with minimally invasive surgery. Also, because of those things, it allows us to do surgery on some patients that traditionally would have been a more high risk where they can't have surgery, but now they can have some of these procedures to eliminate their pain or stop wounds where they weren't able to do that before. And also, it allows us to do surgery without stopping medication. So, people that are on blood thinners, that there are more risks that have to stop them. Now we don't have to stop those kind of medicines. So there's a lot of benefits to it.
Yeah, and so do these surgeries have to be done in the hospital under anesthesia?
They don't have to be. Actually, they can be done at the hospital under anesthesia if people have a preference and would like to go to the hospital. But one of the nice things about these is they can all be done under local anesthetic. So that means that we can do them right here in our own surgery room, which is a huge benefit to a lot of patients.
Yeah, and can you tell me about what kind of equipment you have in the surgery rooms?
So we have the same types of equipment that they would have in the hospital. So we have autoclaves to sterilize instruments. We have a surgery room chair that allows us to put people in the position they need to not only be comfortable but the position that I can do the work. We have what's called a fluoroscopy, which allows us, it's like a live x-ray, so I can see what's going on as I'm doing the procedure. Really, we have everything we have in the surgery room at the hospital, but we can offer it here in our surgery room.
More recently, I've heard that more and more people are offering minimally invasive surgery. So, what makes this office different?
Well, we're different because one, it's I've been doing this for a while. A lot of people have just been kind of picking up on it more recently. But I've been doing this for a while, and because of that, I've been going through a lot of training. In fact, I'm a fellow with the Academy of Minimally Invasive Foot and Ankle Surgeons, which means I've gone to multiple meetings and multiple trainings, not only with people here in the United States, but we train with people all over the world. So people from South America, Central America, Europe, all come together for these meetings, and we get to learn from each other. Also, I'm one of very few people that is actually board certified in minimally invasive foot and ankle surgery. And that sets us apart here too, because it is a process that you have to go through. It takes a lot of work. We have to submit a lot of cases. And so, we've gone through the work, and it shows that we haven't just kind of popped up overnight to try to offer these services, that, we've been doing this for a while, and I've done a lot of training in that.
Well, thank you so much, Dr. Foster, for giving us that information. That was very informative. If you have any other questions about minimally invasive surgery, feel free to give us a call or check out our website.